church graveyard again.
Okay, Chair Dan, we are now live on YouTube.
Okay. I would like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via the Cambridgeshire County Council's website. There's always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare it in German while the fault is addressed, and the public broadcast will be paused. If this is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on the Cambridgeshire County Council's website. So thank you. Can I make a particular welcome to his first meeting to Councillor Criswell. Welcome, Steve. And I hope you enjoy it. It is a joint chair's job, this is, but I've agreed to chair it as this is your first meeting, and I'm sure the one on the, wherever it is in April, you'll be fully briefed and able to do so. So if I could just do a roll call of those present, please. Councillor Criswell.
Present.
Councillor Fitzgerald.
Yes, present.
Handley.
Present.
Councillor Hudson.
Present.
Councillor Ray Bisbee.
I believe he's given his apologies, Chair.
Okay. Council Officer, I've got to give him a title, haven't I? Adrian Chapman.
Thank you, Chair. Present.
Silas. Tireless worker, of course. Dr. Gary Housen. Apologies.
Yes,
Louis
Chair.
Camper.
Again, apologies, Chair.
Balmore.
Present. Hello.
Wendy Overwellmore.
Present.
Dr. Liz Robin.
Present.
And Jan Thomas.
Present.
Also myself, Councillor Holdings. For the record, what apologies do we now have, please?
Louis Camphor, Ray Bisbee, Gary Howsam, Gillian Beasley and Charlotte Black, Chair.
Right. Does any member present wish to declare any disclosable pecuniary interest or non-statutory disclosure interest? If you do, please indicate with your virtual hand. Okay, I don't see anybody declaring anything. The next item is regarding the minutes, and those minutes will be taken at the next meeting, rather than this one, as it's a special meeting. Okay. So we don't have to ask for them to be approved. So we're going down now to public questions. Are there any public questions?
No, Chair.
Thank you. So over to you, Dr. Robin, Director of Public Health, and the latest Peterborough Cambridgeshire Outbreak Management Plan, please. Liz, yours.
Thank you, Councillor Holditch. Yes, just having a little difficulty taking my mute button off. Daniel, would it be possible to share the presentation, please, on the local outbreak management plan? Thank you.
Can we just say why we had to be here this afternoon? Because it had to be in by tomorrow or whatever it is.
Absolutely, yes. So, and Daniel, I think that's showing with one slide and the next slide. Is it possible for it to show with just the main slide? Because people, I know, that's brilliant. That's good. So yes, the reason why we called today's meeting is that we have been asked to provide an updated local outbreak management plan, which used to be called a local outbreak control plan, and to submit it regionally and nationally by Friday of this week. And that's in the light of the updated Contain framework, which was published as a national update on the 18th of March. So we've been working hard to update the plan, and we wanted to bring it to yourselves to have that discussion with you, make sure that you were fully updated on what we've needed to do to meet the regional and national assurance, and discuss with you your steer on how we take this forward, and how we engage with our local residents on it. So that's the reason for the meeting today. It's a special meeting, so that we can have the discussion of the plan with you before it goes up nationally on Friday. Okay, thank you. So next slide, please, Dan. So it's 9 months ago now that we published our first COVID-19 local outbreak plan, which was on the 30th of June. And you may remember discussing it at the Whole System Health and Wellbeing Board just before that. And I think that was before this engagement board was set up. The local outbreak plan is very much set in the context of the government's Contain framework, which again was published back in July 2020. And that Contain framework describes how national, regional and local partners work together with our communities to prevent outbreaks, contain them and manage them. And it clarifies those national decision-making powers and local decision-making powers and responsibilities. So it's very important we as a local authority, or two upper-tier local authorities, and assist a part of a much wider national and regional system, as well as being part of our local system. So upper-tier local authorities lead the local outbreak planning, but as I said, with a wide range of partners. So next slide, please. So this is a sort of for people who like a picture representation rather than words, this is how we've tried to summarise our local outbreak management plan and the revised version. So we have data and surveillance cutting across everything, and our procedures in Cambridgeshire and Peterborough are very much about data and surveillance is what we look at every day, and it informs our response. We then focus, going from left to right, on embedding prevention, and that includes our excellent communication and community engagement functions, our enforcement work, our work with high risk settings and on events, and all really everything that the public does and has been doing to help keep our rates down. We've also included vaccination in the prevention section, because actually vaccinations do prevent you catching COVID and becoming very ill with COVID. There's then a part of the plan that's about stopping the spread of COVID. So it's about testing to find out who's got it, tracing the contacts of that person who may also have COVID, and supporting people to self-isolate so that the disease is not transmitted further. And then we have our outbreak management in high-risk settings, so making sure that in our schools, our care homes, our workplaces, amongst our vulnerable groups, and in our community outbreaks, that we have all the right processes in place. Communications and community engagement spreads right across actually all those aspects, and is something we've really focused on locally. And of course, the governance and resourcing sits behind that. So next slide, please, Dan. So the oversight, management and delivery of our plan. We have the governance as required by the Contain framework, and we have some key groups. So the plan's overseen operationally by officers at the Health Protection Board, which I chair, and involves a wide range of officers and partners. And the actual powers sit particularly with myself and with the Chief Executive as Director of Public Health, Chief Executive of the Upper Tier Local Authority. We have this group providing the political leadership and democratic oversight, and we have the Local Resilience Forum, bringing in those wider partners, the Strategic Coordinating Group, which Gillian and Jan co-chair. And then within this plan, just starting at top left, there's some very relevant groups. There's the Vaccination Confidence Group, which looks at how we work together to encourage vaccine uptake. We then have, moving down, on the left, moving down, we have the Programme Delivery Group, which really delivers the operational plan across the system, ensuring all the partners work together operationally. We have our outbreak management team with a very strong focus on the high risk settings and groups and how we manage outbreaks in each of those settings. And again, that's very much in partnership across the system with different partners for each setting. And within that, but also spreading more widely, we have our contract tracing and our testing functions. Moving to the top right, we have our communications and engagement plan. And clearly this board is very much involved in that. Our community resilience plan through the community resilience group, the CRG, which Adrian leads. And then we have, and I think this is quite particular to Cambridgeshire and Peterborough, it's our approach. We have each district and city council has its own plan and its own rapid response. That was pioneered in Peterborough, but is now across the system, that we have a weekly gold meeting in each of our districts or city areas where we share the epidemiology and really get that local community response. Next slide, please. So the update that we've done over the past weeks is ensuring that we're prepared to meet the new requirements and challenges of the government roadmap out of lockdown and the 4 steps. So we're very focused on outbreak prevention and management throughout that process. Also reflecting more general updates in the contain framework. There's a particular focus in Cambridgeshire and Peterborough on where we are seeing persistent and enduring transmission. And that is particular in Peterborough and in Fenland, where we've seen during lockdown that the cases have fallen more slowly than they've fallen nationally. They have fallen, they're at a quarter of the rate they were at the peak, but fallen more slowly. So we've got enduring transmission, and we have discussed that before. Another key focus is if we get a new variant of concern locally, such as the South African or Brazilian variant, if that's identified through the surveillance, national surveillance systems, we would need to take very rapid action to contain that. So the plan also addresses that. And looking forward, a focus of the plan is really on how do we exit the pandemic phase of COVID-19 and move into what's called the endemic phase, when we know that that COVID will still be with us, but we will be living with it. And actually the outbreak identification and really effective rapid management of outbreaks is incredibly important in entering that endemic phase and just keeping COVID under control. So this plan does go on into the future. We're resetting our strategies through our outbreak management system so that they are fit for this purpose and for this move from pandemic to endemic. And as part of that, operationally, we are saying we need a core team that is absolutely focused on that COVID outbreak management, contact tracing, testing, self-isolation support. And then we need our surge capacity with the people who have learnt over the past year through redeployment how to do this. And it's that balance between the core and the surge that's going to be important over the next year. Next slide, please. So our revised local outbreak management plan will focus on prevention and in particular on maximising the uptake of vaccine across all communities, and also on continuing to work with communities over the coming period on how we reduce the risks from COVID and can live with it. The next focus is ensuring that testing, contact tracing and self-isolation support work very, very effectively locally and that that's sustainable. As I've said, we want to respond swiftly to any rises in infection, including the new variants of concern. And we want to tackle enduring transmission. So that's just reiterating those priorities in the new plan. Next slide, please. And throughout, as themes throughout our plan, we will be working to address inequalities, to mitigate against enduring transmission of COVID-19 in communities and settings at higher risk. And this is something that we're seeing, that the enduring transmission is amongst those communities which are experiencing other challenges such as low wages, perhaps insecure employment, many people living in quite crowded housing. Those sorts of issues do pull together to cause enduring transmission. We will be prepared to use the powers available to us to close settings and locations to help break the chain of transmission, so a compliance and enforcement focus. We'll, as always, ensure that our actions are informed by the surveillance and epidemiology. And as always, we will maintain our very strong and high profile communications and engagement, and really are asking for your help with that as a board, so that we can negotiate our way through the coming months, which will be quite complex as more and more people become vaccinated, but also we are opening up society. We need very good communications to help take the public and our residents through that process in a realistic way. So we'll be maintaining that throughout the plan. Next slide, please. And the vision that we're working towards is sustainable low COVID transmission rates that enable our social and economic life to reopen. We're not aiming to completely get rid of COVID. That's not likely to be feasible, but to have those low rates. High vaccine uptake, especially amongst those at highest risk, but for all our communities. Very effective surveillance that identifies and suppresses the virus and that enables us to think forward. A high performing test, trace and isolate and support system. Strong business community and individual compliance with measures and adapting that as we move through the roadmap. Clear understanding across our communities of moving to this endemic phase and living with COVID not being quite the same as it was before, but we can do this effectively. And clearly this plan supports the wider recovery plan to address the health and economic impacts of COVID. Next slide, please. In fact, I would say this plan's essential to that effective recovery. We need to do this outbreak management and prevention well. And the last slide is just a reminder of the roadmap and what we're aiming to achieve, supported by the various plans involved. So that is, I think that is me. That is our plan, and very happy to take questions and start discussion on those issues that are of most concern to the board.
Okay, members, if you wish to speak, could you please show with your virtual hand, please? Right, Peter Hudson, councillor.
Thanks, John. It's just a quick question. It's not to Liz Ash, it's to Democratic Services. Is there any particular reason why this is not going out on YouTube on Cambridge County Council site and only on Peterborough City Council site? I would have thought it should go out on both of them.
That's what I said in the beginning. It's coming out on the County Council one.
It's on Peterborough City Council at the moment, the YouTube channel, not on the County Council.
I think
through you, Chair, sorry, due to it being quite a short notice meeting, we had to stream it to Peterborough City Council's YouTube account due to a clash. However, we can ensure that the link is on the County Council site as well.
Thanks, Dan. Cheers.
Thank you, Peter. Bill Hanley?
Yes, thank you, Chair. A question for Dr. Robin. You say we're going to have to live with this. It's going to it is becoming endemic. I wonder if you could give us any idea as to how life is going to change. For example, are we going to have to accept an annual vaccination of COVID, perhaps combined with the flu, for example? I think that's really, I'm not asking you to use a crystal ball. It's just give us an indication as to think how it's going to affect everybody, ordinary people.
Thank you. I think that's a really good question, and I'll give an indication. It's something that will develop as we find out more and more going forward and see what works. But we do know a lot more about this virus than we used to. And I think that Jan and others may want to come in, but I would say that we need to keep this virus under control, and we need to do that in this country, and we need to do that throughout the world. So it is going to take some time to get that world approach pulled together and finalised. But vaccination is clearly a hugely important part of this. We can already see vaccination making a big difference. We will, as we go forward, get better and better information about how long the immunity from the vaccination lasts and how likely and frequently we may get variants which would benefit from a booster vaccine. So I think there's some science that will be watched going forward, but I'm confident that vaccination will be a feature of keeping this virus under control for a long time. And I would expect, yes, some regular vaccination, though I wouldn't like to say quite how often it will be. And that may vary between people with different vulnerabilities to COVID as well. You might need more frequent vaccination for people who are the most vulnerable. So I think you're absolutely right. That's going to be a key plank. I think also we've got a huge infrastructure at the moment for testing for COVID, which is absolutely necessary. We now have what we didn't have a year ago in terms of testing infrastructure, but at the stage when the virus becomes endemic, I think there are still questions to be answered about how it becomes gradually more mainstreamed as an illness. So we've got very separate structures for COVID at the moment in some ways with the testing and so on. And I guess in the long term, it's how that testing moves into the mainstream. And we have many other infectious diseases where we do specific tests, we do contact tracing, we do isolation. This COVID is not unique in that sense. And I would see a very gradual sort of the embedding of those systems for testing, contact tracing and isolation into mainstream business, health business is going to be important. I think also there are some changes that, and this is more speculative, but there are some changes that we've seen in some countries which had SARS and MERS and were used to these more dangerous coronaviruses. We have, I think, seen some behaviours in those countries which help them to deal with coronavirus in terms of face covering, in terms of some aspects of social distancing. And there may be some sort of those lower level preventive measures, hand washing as well, which we may want to keep going for some time just to reduce the risk because society's got quite used to them now. So yeah, I think there will be a range of measures that will become clearer as time goes on that we are going to need to take going forward to keep this under control. And of course, a big one is going to be that genetic sequencing of new variants and having very, very effective mechanisms to clamp down on new variants when we see them. So that is a really important part of this as well.
Yeah. Jan, do you want to use your crystal ball?
I think Liz has said it all. To be honest, there is a lot that we've learned, but there is still a lot more that we are continuing to learn. But I think Liz is absolutely right. The basics, I think, are the things that we need to keep in people's mind to keep going with: the face masks, the hand washing, the social distancing. All of these things will be useful. And also, as Liz says, we don't know yet about the booster vaccines. We don't know about the longevity of the vaccines, but we know that already it's starting to help, which is, I think, a really good sign.
Thank you, Jan.
Chairman, can I just say one very quick thing? I probably don't need to say this actually, but the people have got really high expectations come the middle of the summer. They really are expecting us to be let off the leash. And, you know, where, hey, let's go party. I really do think that the comms has got to be really cute to make sure that they don't get that, you know, that impression is removed, really, and the dangers are, you know, we continue to face some dangers and they need to know that. And I'm sorry, teaching Granny to suck eggs, perhaps, but, you know, it's worth saying, I think.
Yeah. That's what happened before. Everybody did gay abandon and we got into trouble again. It's a good point, Bill. Adrian?
Yeah, thanks, Chair. I agree with Bill's point, but I also recognise from all the work we do with our communities that people are desperate and, you know, they are very, very anxious to get back to some kind of normality. And really it links to my point, which is that it would be a great shame, I think, if the plan that we're presenting here today or looking at today becomes just a moment in time. And we've got an obligation to draft this plan. We've got an obligation to submit it tomorrow. And the risk is that the job is done. But actually, for me, it presents us with an opportunity to really use that plan to embed some of the ways that we've been working as normal practice going forwards. For example, Liz mentioned the focus on inequalities and how COVID has affected some groups who are facing inequalities. But actually, those inequalities existed before COVID and will continue beyond COVID. And the plan itself, I think, gives us an opportunity to focus in on those people who are affected by inequality, but beyond COVID itself. Similarly, the vaccine hesitancy and vaccine confidence work. Well, those same people are likely to be as cautious about getting a flu vaccine, for example, or taking other medical treatments. So for me, this is an opportunity, I think, to use the LOMP to really kickstart and re-energise further work way beyond COVID. And I just urge the board to kind of recognise that really and take that opportunity, and let's not allow this just to become a moment in time, a report for report's sake that we have to submit because the government have asked us to.
Al?
Thank you. I thought the LOMP looks very good. Has clearly takes on board the change since the time of the first publication, and all those areas of focus are really important. My question is, are we helping people to self-isolate enough? Somebody I've been in contact just this week, I can see how the daily pressures of life just made it impossible to respond and act and do the right thing around her family circumstance, children at school needing to work, etc. And even though the resources may or may not be there, so that might be a barrier that you tell me there is a real barrier about resources, but it's the accessibility of those resources and how people can access them without going to multiple sites or places or official like looking bodies with data and information that they may or may not have about their personal circumstances. So that is of concern because of the enduring transmission, as you've described in some communities, and for many of the people in that circumstances, I have a huge amount of sympathy, and it's obvious some of the countries who've better dealt with it have zoomed in on that straight away to ensure that isolation is possible. So that's my question. Is there more we can do on that?
I think your question is a bit unfair, and I'll get Adrian. It's his responsibility, and he's been dishing out money like a man with no arms. So would you like to comment on that, Adrian?
Thank you, Chair. Yeah, thanks, Val. I agree with you. And self-isolation is so vital as part of our programme, along with vaccinations, of course. Resource is not an issue, and that's a rare thing to say, but it's such an important part of our defence that we have to find a way of providing the resource that's necessary, and government have been incredibly helpful in that regard anyway. And so most of the support we're able to provide is provided through specific COVID funding from government, alongside the national schemes which provide financial support, albeit that they do go through a process, and I accept that for some people that process is daunting. We early doors set up our own local discretionary scheme. We recognise that for a lot of people, they wouldn't be eligible for the National Financial Support Scheme because that requires certain conditions to be met. So we set up a parallel scheme which requires far less application process. But the additional point I'd make alongside that financial support is that same discretionary scheme also gives people access to practical help, right down to things like, and I always use the walking the dog example, because actually for a lot of people, it's not silly things, actually, things we take for granted actually become very important if you have to self-isolate for 10 days. And if you're a pet owner, how do you get those pets walked? So we can provide all of that and are providing all of that kind of practical support alongside the financial help that people need. And Councillor Holdridge is correct. We've been handing out hundreds of thousands of pounds worth of grants to people, both through the national scheme and the local scheme. It's an opportunity for me to quickly plug the way people access the support, and I think we can never do enough of this promotion. The easiest way for people to find more about the scheme is via both Peterborough City and Cambridgeshire County Council's websites, just do a coronavirus search, or to call the county-wide hub. And I'll just read the number out because this is recorded and hopefully people will be able to access it back. It's 0345 045 5219. And the team will be able to provide direct support very, very quickly.
So there's no difference between the districts. It's all dealt with through the county.
The counties,
councils working together with the county.
Correct, that's right. I mean, we've been doing this throughout the pandemic, working seamlessly across the different tiers of quite complex local government in Cambridgeshire and in Peterborough. But there's a single shared response across all areas.
Okay. Have you got anything you can send, Val? Or is it just as simple as going on there?
I'll happily, if I share links with Daniel for the minutes, we'll include some links and so on in the minutes, if that's acceptable.
Okay. Happy with that, Val?
Yeah, I'm aware what's available. I'm saying, are we doing enough and can we do more for the future? It's the future orientation that I'm keen on. Thanks.
Okay. Peter Hudson.
Thank you, Chair. I just want to go back to the local outbreak management plan that's been very nicely explained by Liz, and it's probably more of a question for Jan, actually. We spoke about embedding prevention and stopping the spread, and of course, central to this is the vaccination rollout, which is going fantastically within Cambridgeshire. But the question is, Jan, perhaps you could help me here. I've had quite a bit of communication from people in Fenland, and Doddington Hospital, although they've run out of patients for their first vaccination, they tell me they're not allowed to give the second vaccination, although they have supply of vaccination. Is there any particular reason for that? I can get back to the people and tell them.
So they're contacting quite a lot of people, Peter. So I'm very happy to again pick up with them as well directly. We are working under very strict guidance under the vaccinations. We are not currently allowed to go into cohort 10. There is very strict clinical reasons why the second vaccination was timed as it was. There is an issue with a national system inviting people. The PCN's also trying to find people to come in. The comms has now changed in the last 24 hours. Again, you'll remember we did this in February, where we said, if you haven't had it, please contact us. Don't wait for us to contact you. So that comms has changed. I think we are, as we go further through the cohorts, we are going to see uptake reduce. We are finding it is more, we were able to achieve higher percentages in the older groups than we will be doing in the younger group. So the comms teams are working very hard on that. But I'm afraid it is all around us making sure that we follow the very strict guidance that are based on strong actuarial evidence for who we need to target and how we need to use the vaccine. And there are licensing, pharmaceutical licensing reasons for that, and contractual reasons for it as well.
Yeah, I understand that. Thank you.
Jan, while you got the floor, are there any updates on how many people have been vaccinated in the, say, under over 60s or?
Yes, if you just give me 2 seconds, I can give you the absolute latest. She says trying to open her files. Could you just give me 2 minutes and then I can run through all of those numbers, Councillor Holdridge, if that's okay?
That's fine, yes. Steve Criswell?
Yes, thank you, Chairman. Actually, Adrian stole some of my thunder, which isn't surprising as we work so closely together, but it was on the issue of inequalities. And Liz, in one of your slides, you said address inequalities in order to mitigate the impacts of COVID. And, you know, if we're to give political sign off to this, and I'm sure John may feel the same from Peterborough, dealing with inequalities is something we strive to do anyway. So I haven't been able to sense check the document that the actual plan to see if your slide terminology is reflected in the plan, but I would hate people to think we were only dealing with inequalities because of COVID. So, you know, I would word it that our quest to address inequalities will help to mitigate the impacts of COVID rather than the other way around. So just if we could just check the document to make sure it makes that clear, that would be helpful. Thank you.
You've got your hand up, Liz. Do you want to take that and use the space?
Yes, yes, of course. And actually, that was one of the points, in a sense, I was wanting to come in with. I do entirely agree. That is, the addressing of inequalities is absolutely key. And what we're seeing is that some of the health inequalities that we saw before COVID are now being played out with COVID as well. So it's the same geographical areas, some of the same communities that are now experiencing the enduring transmission of COVID, and often for some of those similar reasons, which make it more difficult for some communities to take those steps to stay healthy. So absolutely, and very happy to check the wording on that and to change that around if it's not appropriate. I think the only other thing I'd say, and it is picking up on Adrian's response on the self-isolation, absolutely, we can help. We've got a phone number, we've got volunteers we can support, we've got funding, we can support people to self-isolate. But what we're finding with regard to some of these inequalities is that there are some deeply entrenched inequalities, which mean that some people are not coming forward for this support. Or they sort of have worries that go beyond some of the things that they feel we can help with, like if they're on a 0 hours contract or agency contract and they are very uncertain that they will get their job back after 2 weeks isolation, then that can stop them coming forward and stop them being able to behave safely. So I think absolutely agree, Councillor Criswell. It's some of those more deeply embedded issues and communities who we want to work with anyway to address inequalities that we also need to be targeting through some of our COVID work in this plan on enduring transmission.
Thank you. Happy with that, Steve?
Yes, thank you, Chairman.
Yeah. Jan, you're back again? She put her hand down there. Bill?
I'm here. Sorry, is that better?
Yeah, so go ahead.
Apologies, I'm having a bit of a, as you can tell, a technology nightmare today. So if we look at the summary of where we are on by age group, for every cohort from 70 upwards, we are at least at 95%, which is great. If I look at the 65 to 69s, we're at 90%. And if I look at the 60 to 64s, we are around 84%. So in vaccine programme coverage terms, if we could get that every year in flu, I think we would be delighted. So that is really good. Because we are really just still doing the other cohorts, we are at around 72% for the 55 to 59s and way over halfway through the over 50s. And this is my local numbers. These are not the nationally reported numbers, but these are the numbers that I take out of the GP practices. Can I just talk briefly, though, about the point about inequalities? So if I look at this data, because we track this very, very closely by PCN, we look very much at the inequalities. And what we are finding, which might be logical, but the impact of inequalities, and particularly deprivation, gets worse as you get through the younger cohorts. So actually it plays out less in the older cohorts, and we've seen no statistically significant change driven by inequalities or deprivation in the older cohorts, but it grows as we go down the younger cohorts, and we're worried as we get into effectively everybody else that we've got to invest much more time in making sure the indicators of particularly deprivation really play through into our strategies for delivering the vaccine, because it gets more stark as you go down those cohorts. And we talk about inequalities a lot, but and we talk about for example, the challenges with different ethnic groups, different cultures, etc. But I don't want us to lose the point about it. The biggest link that we have found so far in the data is deprivation, which I know is linked to some other of those areas, but we need to be very clear this is a link with deprivation specifically.
Thank you, Jan. Bill?
Thank you. I'm still, Chairman, trying to get my head around what the new normal might look like. And I'm just wondering whether or not, we hope that people will behave, social distancing, mask wearing and all of those things might themselves become kind of endemic. But surely there's going to be a need also to adjust things such that enforcement is possible where needed. I'm thinking, for example, in the case of public spaces, pubs, clubs, sports arenas, the safe limit might be, for example, for a nightclub, the safe limit might be 300 people for fire limit, but it might be a fraction of that to make it safe for COVID. I'm just wondering whether or not licenses we're going to have to look at them in the middle term. Maybe every license needs to be looked at, or am I just being too pessimistic?
I think I did see something the other day, Bill, where they were going to experiment. I think we're going to do it with the snooker, where half the place would be social distances and the other place would be as normal, to see what happens. But I don't know whether the officer's got any update on that. Have you got anything on that, Liz or Adrian?
I would just say that I think there has been some very good guidance produced by the Health and Safety Executive and other bodies on COVID safety. And there's a sort of approach that you can take, which is about using more general legislation about having a safe workplace. Then there's some coronavirus specific legislation for upper tier local authorities about safe public spaces, safe events and so on, which we can use. And we are learning, and Adrian may well want to come in on this from the enforcement perspective, but we have actually got quite a lot of powers that we can use at the moment to say, we think this is going beyond a limit where it will not be safe for people because of the risks of COVID. And we can make, in a sense, that give quite individualized directions orders and things like that around what is happening. But it would be, as we go on and we learn more, I would probably expect this to become more and more perhaps embedded in national standards and things that we can enforce, because at the moment it is a bit more, quite a lot of it is very local and those local judgments. So I think it's an unfolding field, but enforcement is going to continue to be very important. Adrian, I don't know if you want to add, because I know your team's done a lot of work on this.
Yeah, thanks, Liz, if that's okay, Chairman. I was just looking at the latest version of the contained framework as well, which sets out effectively the detail behind the legislation, and that does continue to major the point around enforcement being the ultimate sanction, and continues to kind of ensure that local authority enforcement alongside other agencies such as HSE that Liz has described, but the Gangmasters licensing authority, the police and other agencies have got the right powers. My view is, as Liz is, that I think over time it will change at a national level, but we shouldn't wait for that locally, and we should continue to work with businesses in particular to encourage them, using the 4 E's really, to encourage them and educate them to comply, but also to be close enough and to be ready to enforce should that be absolutely necessary. And with that in mind, we've carried out in the last couple of weeks an end-to-end review of all of the powers that we believe we have, both COVID related, but also business as usual powers, and to make sure that we understood them and that they were all being deployed. And it was actually quite a reassuring exercise. It showed that we were in the main using all of those powers, but actually we could probably go a bit further where necessary. And enforcement has to be the final sanction. Nobody really wants to be enforcing where we can find an alternative, but I'm confident that using the contained framework, using the guidance and ensuring that we remain close to business, we've got the powers currently to deploy should that become necessary, until such time as the national legislative picture changes.
Thank you.
I think I saw, Adrian, something on football grounds that we're going to open up on one of the stages for 25% of the capacity of the ground, were they?
That's right. There are a number of national pilots going on right now to build learning at different venues, different settings. So we're watching all of that with close interest, and I think that will probably inform national policy.
indeed. Okay. I don't have any other more raised hands. So are you happy that we've addressed the issues of this? Are you happy to endorse the outbreak management plan?
Yes.
Is anybody against? Please show. All right, Democratic Services, are you happy that that has been done?
Yes, Chair.
Okay, well, thank you very much then. Is there any other business? No, that's good. Thank you very much. Thank you all for your attendance. I think it's been a good meeting. Got quite a bit of, what should we say, knowledge out of it. So thank you very much for that.
Thank you, everybody.
Launch it.
Bye.
Okay, thank you.